And call to order the Committee on Health and Welfare. We're going to start as a subcommittee with Senator Arthur presenting Senate Bill 931.
Madam Chair and member of the committee, it's my pleasure to introduce Senate Bill 931, which seeks to improve and protect access to healthcare services for Missourians. Since the start of the pandemic, demand for healthcare services has grown in Missouri, and more people are receiving those services than ever before. Since so many Missourians lack internet access, audio-only telehealth has become a popular choice. With audio-only telehealth, providers and patients don't have to worry about reliable internet connection or knowing how to use a smart device or computer. Not surprisingly, it's become a preferred choice among rural and elderly Missourians. Audio-only visits can make patients feel more comfortable and safe. For example, children who have experienced abuse or young people struggling with issues like disordered eating or depression or suicidal ideation may feel more comfortable with an audio-only option. And we have some providers here who can speak to that. Senate Bill 931 will ensure that audio-only telehealth is covered by health insurance providers. 21 states have already passed this legislation, including states like Iowa and Kentucky. It also protects a healthcare provider's ability to choose their own telehealth platform by preventing insurance companies from mandating the use of a specific telehealth platform, and this is HIPAA compliant. So, in short, it protects a critical tool that has and continues to expand healthcare access to people all over the state. Thanks for your consideration, and happy to answer any questions.
Thank you, Senator. This bill is a bit of a pared down version of a bill that we heard last week. Can you talk a little bit about where your changes are, or is that putting you on the spot?
I might have the other version of the bill. I don't
have a chart, and that's okay if you don't either. I just wanted to kind of see. It seems like this is more narrow in scope.
It is, yeah.
His.
Mm-hmm. Yep, that's fair.
One of the concerns last time we heard one of the telehealth bills, and it might have even been while I was in the House, was trying to make sure that we aren't accidentally creating a patient-client relationship before there is an actual patient-client relationship. Are you concerned, or doctor-patient relationship? Are you concerned about that happening in this?
I appreciate that question. I think as part of some of the licensure requirements, healthcare providers are required to meet in person with patients and establish that relationship. Mm-hmm. And then it also requires in-person check-ins. I don't remember the specifics, but that is a consideration so that it's not just an audio-only relationship.
So this wouldn't supersede those rules based on the change in the statute?
No, in order for them to be compliant with their licensure, they would have to follow those practices.
Okay, thank you. That's so helpful. Do you have any questions for this Senator?
Sure.
Thank you. First witness in support, please come forward.
Hi, nice to see everybody. I'm Dr. Chuck Hollister. I'm a licensed psychologist, CEO, and Director of Professional Affairs for the Missouri Psychological Association. I'm also testifying today for the Missouri Mental Health Counselors Association that support the bill. I'm going to, since Senator Arthur did such a good job of covering some of the most salient points, I'm just going to hit on some spots that I think are particularly important. This is really a good news bill. This really, the one bright spot that we had during the pandemic was the expansion of telehealth and getting to have experience with that. This audio-only telehealth really guarantees that we'll have better access for 1 million Missourians who are without reliable access to broadband access. It gives 1/3 of the elderly lack access to smartphones or computers. They simply don't own it. And there's just tens of thousands of people who are just perceive themselves as kind of technologically challenged that really depend on audio only. Let me give you a patient example. Somebody called me the other day and was describing this patient. It's an older woman who lives at home with her disabled husband. She's his sole caretaker. It's very difficult for her to get away. It's certainly very difficult for her to arrange for regular separation from him. So audio-visual telehealth sounds wonderful, doesn't it? And so they tried that. The only trouble was that it made her tremendously anxious. She had trouble with the technology. The sessions became about how to help her with the technology, not to help her with her mental health issues, which brought her into care. And so when they switched to audio-only telehealth, she was fine. Things got better for her at that point because that was something she was comfortable with. So we want technology that matches the patient, right? The patient shouldn't always have to match the technology. Another example is a man who lives in an area where there's poor internet connectivity, rural area, and as a result, and he's lost his ability to drive. So how does somebody like that access healthcare? Again, audio-only telehealth becomes a real life-saving process for that. So when you look at it, you're looking at something that's safe, convenient, popular, therapeutically beneficial, cost-effective, secure. The U.S. Department of Health and Human Services says that it's absolutely HIPAA compliant in the same way that audiovisual telehealth is. In one of the other hearings, I thought this was a good question to ask. There was some minor curiosity about is audio-only telehealth particularly vulnerable to fraud? And Medicare looked into that issue, and I can tell you quite frankly, no, it isn't. As a matter of fact, what they found is that when there is fraud in audio-only telehealth, it's the same thing that happens in in-person care and in audio-visual care. It usually doesn't happen while the service is being delivered. It happens in the billing process. And the billing process is the same for all of those. The other thing that you should know is that when people talk a lot about it, this I think is an important issue just for you guys to understand, that anytime people talk to you about fraud and these sort of things, the majority of it usually is some sort of provider error in how they coded or billed the service. It usually doesn't have anything to do with criminal intent or anything like that. So what they found is that it's safe, it's secure, it's free of serious problems with fraud, it's therapeutically beneficial. So anyway, thank you for considering the bill. I think this is a wonderful advance. It's something we can all go home and be proud about.
Thank you so much for your
Sure.
testimony. Are there any questions for this witness? Seeing none, thank you. Next,
you.
witness in support, please come forward.
Sure.
Chairman, members of the committee, my name is Cassie Brown, and I'm the Executive Director of the National Association of Social Workers, Missouri chapter. We represent social workers who are the largest behavioral health workforce in the nation and in Missouri. We support this bill and thank its sponsor for coming forward with it. One of the things that I usually come before committees prepared to speak about is statistics and good arguments with the voice and ethics of my profession and Missouri's behavioral health workforce backing me, and all of this is still true. The witnesses before me have spoken very clearly to this. I would like to speak as a rural Missourian myself, as well as a clinician today. NASW supports telephonic telehealth because expanding the current definition to include audio-only access benefits older adults and disabled people. But also, I served as a clinician in a rural area. When I returned to my home state of Missouri, I am a Missourian, in 2021, I provided substance use treatment to clients in my home community in Pettis County. I was permitted to provide telehealth to ongoing patients in my community, but however, when the weather was bad, this meant during a few storms, I had to cancel sessions with clients not because they were unmotivated, but only because they had no video conferencing capabilities. They only had access via phone, and I couldn't continue services with them at that time. Now, substance use disorders treatment requires consistent treatment. As a clinician, my inability to provide services at that time due to that lack of technology was a harm and an ethical difficulty that I faced. I am extremely fortunate to have internet in my hometown of 570 people, but the largest piece of internet infrastructure in my community is the water tower with my town's name on it. There's no fiber, no cable. We have townwide Wi-Fi provided by a router, which has to be placed on the highest facility in my community. We are one of the communities that is underserved. It has no broadband. As a clinician, I do feel this is very important to continue to provide services in rural areas. For the good of Missouri's patients, we ask you to vote yes on this bill. I thank you, and I stand ready for your questions.
Thank you so much for your testimony. Are there any questions for this witness? Seeing none, thank you for being here today. Next witness in support.
Yeah, we're on. Okay. Good morning. My name is Dr. Amy Beck, and I am presenting today on behalf of the Missouri Psychological Association. And I also have testimony from Dr. Jessica Gerfen. She is representing as a CEO of the St. Louis Behavioral Medicine Institute. And so, again, thank you, Senator Arthur, for sponsoring this bill, as thank you also to Senator Coleman and to the members of the committee. I wanted to share just another hands-on experience of what this bill is talking about. I have served for 13 years as a pediatric psychologist in a children's hospital in Kansas City. And my medical specialty is obesity medicine. And so I work in a multidisciplinary clinic with physicians, dietitians, social workers, nurses, and I collaborate with psychiatrists, occupational therapists, and surgeons. And we serve, as a specialty care clinic, we serve a broad catchment area. We have patients coming from 5, 6, 7 hours away to receive our care. And we have all used telehealth extensively in the past 4 years. And it had a significant impact on patients coming and attending appointments and receiving their care. We actually have a study from before the pandemic that looked at barriers to care for this population. And it was a study that was done in our hospital in Missouri, as well as several other children's hospitals across the country. And the number one barrier to care was transportation. And so telehealth reduces that barrier. And additionally, during the pandemic, rates of obesity increased dramatically. We've had wait lists of 5, 6, 7, 800 kids, and that was the last time that I checked. So when kids are scheduled, they need to be able to attend those appointments. And so, you know, kids are kids. Sometimes they're sick. And so that's a easy thing for parents to now do is say, you know what, my kid is sick, but let's switch to telehealth. So it's still able to keep that appointment that is so hard to get, but without additional stress to the child or to the clinic members. But when using audio-visual telehealth, a common challenge is spotty internet connection. Only 5 states have poorer internet infrastructure than Missouri. And I'm sure we've all been in a bad Zoom call, right? First, the video starts to freeze, it runs slowly. Then the audio starts to sound robotic, it chops up, then it speeds up. And it's really difficult to complete a medical appointment when this is happening. But these appointments are medically necessary and they have to continue. So the way that we get it to continue is to turn off cameras. And that turns an audio-visual telehealth appointment to audio only. And I've also experienced when the platform just isn't working, right? The IT guys are standing behind me trying to figure out why the audio-visual platform isn't working. And so again, we've had to use the phone and audio only for that. All my multi-specialty colleagues have navigated this. I've completed suicide risk assessments and other behavioral healthcare audio only because it was either that or discontinue the appointment, which is unethical and it's also considered patient abandonment. So in short, my colleagues and I need audio only so we can continue offering audio-visual care as we have done and our patients have benefited from over the past 4 years.
Thank you for your testimony. Are there any questions for this witness? Seeing none, next witness in support.
Good morning, Garrett Webb, registered lobbyist on behalf of the Missouri chapter of the American Academy of Pediatrics. Just a note of appreciation to the sponsor and to you for hearing this bill. A couple of things, especially for first-time parents or maybe guardians who haven't been responsible for the care of a child in a while. They tend to call their pediatrician's office for just about everything, especially at the beginning. And those pediatricians have other patients that they have to see, but of course they want to respond in a timely fashion and make sure that, if the situation warrants an in-clinic visit or a trip to the hospital, that they're able to respond to that. Or if it's just a simple, over the phone what they need to talk down the parent and give them a little bit of advice to calm them down. But they should be able to be reimbursed for that. And part of the policy that SB931 allows for is that no insurance carrier can mandate what platform you have to use. So one insurance carrier can't say Zoom while another says WebEx. So as long as they're HIPAA compliant, that provider can use whatever platform the family's familiar with or the clinic is already set up for. The other thing that a lot of our members have expressed is that when there's inclement weather, you still want to continue that well-child visit if possible, and that isn't always possible during inclement weather if your internet connectivity is affected by that. And so this allows you to have that well-child visit, check on the health of the child, check on the health of the parents, the mental health, and ensure that that child's well-child visit is still able to be completed to the best extent possible. And then finally, the last point that we wanted to add is that the Medicaid program has already made this permanent for Medicaid program participants, so we think that there should be parity with that with private insurance carriers.
Thank you for your testimony. Are there any questions for this witness? Seeing none, next witness in support.
Madam Chair, members of the committee, Rob Monses on behalf of the Missouri Hospital Association, here to support Senate Bill 931. We think it's common sense legislation that will help provide better access to care across rural Missouri.
Any questions for this witness? Seeing none, next in support, please come forward.
Madam Chair, Randy Scher, representing Missouri Academy of Family Physicians, and I have nothing to add. So,
Thank you for going on the record in support. Any other witnesses on support?
Chase Campbell going on record in support for Rankin Jordan, Missouri Association of Rural Healthcare Clinics, and I think that's it. Thanks.
Mr.
Oh,
Campbell,
Cox Health, yeah.
have you filled out a form?
I'm working on it.
Thank you so much.
Thank you.
Any questions for this witness? Seeing none. Anyone else here to testify in support? Anyone here in opposition, please come forward. Anybody here in opposition? Anyone here for informational purposes only? Senator, before we conclude the hearing, because there was another bill that was filed that was very similar, although more expansive than your bill, are you comfortable having those rolled in together? Would you like to be separate?
I think it probably matters what that version looks like, but my preference would be to remain separate.
Okay, perfect. Thanks so
Thank
much
you.
for that. Okay, that will conclude our hearing then on Senate Bill 931. We're going to make a motion now to move into executive session before continuing on with the hearings. So we're going to first make sure that we have established a quorum and to move from our subcommittee into a full committee. So Madam Secretary, if you would please call the roll.
Senators Coleman. Here. Carter. Here. Arthur. Here. Gannon. Here. Moon. Thompson Raider. Washington. 6.
With 6 members present, we do have a quorum, and I'll be looking for a second to move into executive session. Senator Gannon is seconded. All those in favor, please say aye.
Aye.
Opposed? We have now moved into executive session. I'm finding my notes to see what we're hearing. Okay, great. I'm now looking for a motion to bring forward vote do pass Senate Bill 874, introduced by Senator Bean, which repeals provisions related to hemp extract for the treatment of intractable epilepsy. Do I have a second? Senator Carter seconds, since Senate Bill 874 is now before the committee. I now move that we vote Senate Bill 874 do pass. Do I have a second? Senator Carter seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman.
Aye.
Carter. Here. Yes. Here. Yes.
Yes.
All right. Arthur. Gannon. Moon. Thompson Raider. Washington. 6-0.
By your vote of 6-0, Senate Bill 874 has been voted due passed. I'm now moving to consider Senate Bill 1326, introduced by Senator McCreery, modifying provisions related to forensic examinations of victims of sexual abuse. I now make a motion to take up Senate Bill 1326. Do I have a second? Senator Carter seconds. Senate Bill 1326 is now before the committee. And I'd now like to make a motion to vote Senate Bill 1326 due pass. Do I have a second? Senator Arthur seconds. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Raider, Washington. 6-0.
By your vote of 6-0, Senate Bill 1326 has been voted due pass. Now, Senator McCreery has asked that we would pass this consent, which is a second motion. And before I make that motion, I'd like to just see if there's any member of the committee who would not favor that. And if that's the case, then we'll probably not make the motion. So is there any discussion before I make the motion?
Yeah, I don't have my committee book, Madam Chair, in front of me yet. I don't really have concerns, but I'm not sure if it should be a consent bill.
You're concerned that it's a substantive change of policy and therefore not a consent item? Okay, then we're going to go ahead and leave it voted out of the committee, due pass unanimously. And with that, I'd like to make a motion that we move back into session. We had to hear Senate Bill, I think Senator Moon next.
Well, I have 1260 and 1212.
Okay, so Senator Gannon, Senate Bill 1260, you're ready? And I apologize to everyone. We had noticed up to the committee another bill that when I was reading through the Senate committee substitute, I had a question for the sponsor on. So I'm going to just go ahead and hold that bill and have a conversation with him before we bring that other bill in front of the committee. Senator Gannon, please proceed when ready.
Good morning, Chairwoman, members of the committee. For the record, Senator Elaine Gannon, representing Senate District 3. Thank you for the opportunity to present Senate Bill 1260. Currently, when a woman attends her first prenatal examination, the physician or healthcare provider will test for syphilis, hepatitis B, and such other treatable diseases and metabolic disorders as are prescribed by the Department of Health and Senior Services as long as the woman consents. This is usually around 6 weeks post-positive pregnancy test. Senate Bill 1260 does two main things. First, it adds hepatitis C and HIV to the list of diseases being checked for. Second, it adds an additional test to be done at the 28th week of the pregnancy, again with the consent of the patient. This testing is currently covered as part of prenatal care by insurance companies and Medicaid. Because hepatitis C and HIV can be contracted at any time during the pregnancy, the discovery of the infection as soon as possible can lead to quicker treatment and lower the chance of the child contracting the infectious disease. If the mother tests positive for any of the diseases, the healthcare provider shall treat her according to the most recent accepted medical practices. This is important because all of the diseases listed can be safely treated during the pregnancy without risk to the mother or the child. Healthy moms equal healthy babies, and this is just another step we can take to ensure our most vulnerable population gets the health care they deserve.
Thank you, Senator Gannon. Are there any questions for the bill sponsor? Senator Moon?
Thank you, Senator. I noticed that on the first page you have a part of the current statute being removed, and you have an addition that meets the current medical practice. Is there something that is different now in the current practice than what is being removed?
I don't think so.
Okay. So I guess in essence, that would, if practices change in the future, they could still do that. That makes sense.
Yeah.
Okay. And you say this is, I believe I read that, with the acknowledgement of the patient. They would have,
Yes,
have to approve.
definitely.
Okay. All right. Very good. All right. Thank you, Senator.
Any other questions for Senator Gannon? Seeing none, first witness in support, please come forward.
Good morning, Katie Gamble here on behalf of the American College of Obstetricians and Gynecologists and the Missouri Center for Public Health Excellence. Want to go on record in support of the legislation and thank the senator for bringing it forward. We've seen an increase in the number of congenital syphilis cases in the last several years. So in 2015, there were two for the entire state, and then in 2021, there were 63 cases. And so the goal of the legislation is to get later testing. Some moms don't get testing or don't get the prenatal care that they need earlier on, and so we want to make sure that they're not missing that important screening so that we can treat these diseases and help have better health outcomes for our children when they're born.
Thank you. Any questions for this witness? Seeing none, next witness in support, please come forward.
Garrett Webb again for the Missouri chapter of the American Academy of Pediatrics. I think it's no secret here that I love this senator very much and appreciate her bringing this bill forward. Pregnancy does not make you immune to an STI, and we know that STIs can severely complicate pregnancy, not only for the mother, but also for the child. We know that pregnancy-safe treatments are available and that this helps for identifying those potential instances and helping the physician to treat them immediately or as soon as possible, because we know the sooner the mother starts treatment, the better health outcomes the baby and the mother have.
Thank you for your testimony. Any questions for this witness? Seeing none, next witness in support, please come forward.
Chase Gamble going on record in support for St. Louis Children's Hospital. These STIs can make women more susceptible to worse infections such as HIV and also have a very adverse effect on the child that's being birthed.
Any questions for this witness? Seeing none, thank you for your testimony. Next witness in support.
Good morning, Deanna Hemphill on behalf of Missouri State Medical Association, just echoing the testimony that's already been given. We do feel that this bill results in better health outcomes.
Thank you for your testimony. Any questions for this witness? Seeing none, next witness in support. Anyone here in opposition? Anybody here for informational purposes only? Seeing none, Senator, do you have any closing comments?
Thank you, and I appreciate the support for such an important bill. Thank you.
Thank you. That will conclude the hearing on Senate Bill 1160. I now move that we move, I'm sorry, 1260. I now move that we're into, now I move that we hear Senate Bill 1212. Senator Moon, proceed when ready.
Thank you, Madam Chairwoman and committee, for allowing me to present Senate Bill 1212. This is essentially a transparency bill. It's known that AI has been used to calculate the highest prices based on credit scores and credit card limits, which is kind of bizarre. Hospitals have code books, and what we're asking is that these codes be posted in places where the public can see them. And additionally, this bill will allow for any charges that are disputed. There will be no collection procedures enforced at that time. And we recognize that hospitals should be profitable or they're going to go out of business. So we're not trying to undermine that. We're just wanting to have fairness and transparency in what patients are being charged. This bill also allows for the consumers to be protected during that process. We're grateful for Rob Monsees and his input, and we hope that we can continue to work together to reach good conclusions. There's one particular portion in the bill that we still need to identify and make sure that it is understandable, and that's when it talks about material compliance. So we're working through that particular definition at this time. If you have questions, I'd be happy to attempt to answer them at this time.
Thank you, Senator. Are there any questions for Senator Moon? Senator Arthur?
Hi, Senator. So I like the spirit of the bill, which is about transparency in pricing and protecting
Yes.
Missourians as consumers. So I appreciate that very much. I think one of my concerns involves a patient's ability to file a lawsuit against a hospital. And can you talk a little bit about why you think that would be the best recourse?
Well, hospitals are pretty powerful. They have big lobbies and usually can hire pretty well-trained attorneys. And so if your question is why they can't file a lawsuit, I don't know if I have the answer to that directly, but I think they should be able to file. And at the same time, I think it's also mentioned in the bill that if they are successful on the prevailing side, that those attorney's fees would be paid for them as well.
So I think my concern is, and you're right, that like in areas like mine, there are major healthcare systems
Yep.
that could probably afford those costs, but in rural areas, especially, and you know, I'm thinking I represent 2 community hospitals, and I don't know that they would have the financial wherewithal to be able to defend, or in the event of a judgment against them, be able to operate.
Yeah, and that's reasonable. I think that they could avoid any of these disputes by just posting the codes. If they will make their charges transparent, that should solve the problems.
Yeah, but you know, there are always lawsuits filed, and litigation takes time and money.
But with regard to this bill,
Yeah.
if it's not related to the cost, it wouldn't relate.
Okay, I appreciate
Yeah.
it. Thanks.
You're welcome.
Thank you. Any further questions of Senator Moon? Seeing none, first witness in support, please come forward.
Madam Chair, members of the committee, Alex Eaton, representing Missouri Century Foundation. We would like to go on record in support of Senator Moon's bill. This bill has been filed in previous years, but the Federal Hospital Price Transparency Act was established in 2001. As of today, or 2024, 34% of hospitals are not compliant with this, with the Transparency Act. We believe this gives power to consumers and helps drive down medical costs. So really appreciate Senator Moon bringing this forward, and happy to take any questions.
Thank you for your testimony. Is there any questions for this witness? Seeing none, next witness in support, please come forward.
Thank you.
Any other witnesses here in support of Senate Bill 1212? Next witness, and we're going to move to opposition.
Madam Chair, Rob Monsess on behalf of Missouri Hospital Association, here to testify in opposition to Senate Bill 1212. Appreciate had the opportunity to sit down with Senator Moon and his staff to discuss this. We have a number of concerns related to the legislation. The chief among them is this new cause of action that would be created if the trigger in the bill is met. We think the trigger, that being materially compliant, is not defined substantially in the bill, so it leaves open a great deal of risk to hospitals across the state. I would point for the record, we've got a document here that shows all of the different federal transparency rules that hospitals are obligated to comply with today. Despite the rule that was mentioned in previous testimony that started in January 2021, there are several others that started as far back as April of 2014. These rules are constantly being changed and updated. There were a series of new changes that came into place in January 2024. There was another round of changes in July, starting in July, and then another round of changes again in January 2025. So there are a lot of things for hospitals to try to keep up with. The data that was mentioned by the proponent earlier, we think is not factually correct, not even close to correct. This 36% figure is a figure that's being put out by the group, I think, that is behind this legislation. It was passed in Colorado, and there's a group, trying to find this report, but it's called the Patients' Rights Advocate.org. Cynthia Fisher, I think, is the main proponent of that group. They put out a report back in October of 2023, and they're the ones that publish these statistics. If just doing analysis on my own and trying to prepare for this hearing, I found a report from Turquoise Health, which is a company that was started prior to any of these federal transparency programs being put out, that is funded by Andreessen Horowitz, publicly funded company, and the CEO is a guy named Chris Severn, that in his blog posts and his reports put out on transparency, hospitals across the country are operating at a 90% response rate to those federal transparency rules. I think the differential there is if there's any kind of missing field, open field, that sort of thing, there are literally millions of lines of code in these machine-readable format presentations that hospitals are having to make. So I think that's the difference in these numbers. We have 36% quoted by the advocates of this legislation, and this independent group that quotes it at about 90%. We further think that in Missouri, we've got a difference in Missouri than in Colorado, where this is passed. We had a statute passed in Missouri back in 2016. We worked with the then chair of the House committee, Dr. Frederick, on the Healthcare Cost Reduction and Transparency Act. So hospitals in Missouri are largely complying. The only ones that in a review of the compliance with this, the VA hospitals and federal facilities, some of the behavioral hospitals that we think are complying with the federal rules, which allow them to comply with the state legislation. There's compliance with this. There's a number of things that are available to the public. We've had 90,000 hits on our website, which is how these transparency things are reported according to state statute. So we think it's odd that this group that put out this report is singling out hospitals as the main place for the penalties according to the transparency. If you read the report, which I took some time to do so, there's some things that I actually would agree with. Basically, it says that healthcare deliveries become contaminated with countless opaque middle players that pursue revenue cycle optimization and profiteering, driving up costs and distorting the market. These middlemen include insurance carriers, third-party administrators, nurse navigators, claim processors, billing department administrators, pharmacy benefit managers, and group purchasing organizations. According to OECD data, around 1/3 of U.S. healthcare spending in 1975 was paid directly from patients' wallets versus 11% in 2023. So we agree with that. We don't understand why the report that's put out by the advocates of this group would highlight all of these middle players, but the legislation presented today doesn't affect any of them. There's no doubt that there's a lot of complicated costs associated with healthcare. We do our best to help provide $1.65 billion in uncompensated care for Missourians every year. So we would hope that we can happy to work additionally with the sponsor on this. And at this point, as the underlying bill, we would be opposed.
Rob, quick questions. What percentage of Missouri hospitals are in compliance with the federal requirements for price transparency? If it's not 36% and it's not 90%, right? Because 90% is federal, according to the one study, and 36 is what the advocates are saying. What percentage is it here in Missouri?
I don't know. I will have to see if there's a way for us to track that. It's not something that we're currently tracking at the association.
Okay. I understand that because things are changing constantly, materially compliant, it sounds like was trying to make an attempt to make an acknowledgement that these provisions are constantly changing at the federal level and try to make sure that it's more likely than not maybe that they're being complied with. Is there a definition that the Hospital Association feels comfortable with saying if it's 50% of the fees are published, if it's 75% of the fees are published? What would you think is a reasonable response for patients to be able to expect to know what the pricing is?
Yeah, I'm certainly willing to have that conversation. I don't personally know what that right number would be at this moment, but happy to get with our subject matter experts at MHA to try to figure that out.
Do you think that a percentage of regulation compliance is the right path to define materially compliant, or do you think that that is there's some different way to define that that'd be preferable?
I'm not sure at this time, Senator.
Okay. Okay, thanks so much. Anybody else have any questions for this witness? Senator Carter?
In that report, how many of the cases do you know in Colorado were filed against the hospitals, but they were basically didn't go to court?
I don't know.
Okay, thanks.
Any other questions for this witness? Seeing none, thank you for being here. Any other witnesses in opposition?
Chase Campbell, representing BJC and Mosaic Healthcare, would just go on record in opposition, echo MHA's concerns with the bill.
Chase, can you please find out for me whether your clients are compliant with the
Yes.
federal pricing requirements?
Will do.
And also tell me how much is 500 milligrams of acetaminophen distributed in their emergency department?
Yep.
And
easy
what
enough.
would a pediatric femur x-ray cost? Those seem like two random examples that people probably encounter on an ongoing basis, and we should be able to figure out how much that costs if they're compliant with the requirements to be transparent.
Will do.
Thanks. I appreciate it. Any other questions for this witness? No, it's not experience a femur, but, insert kid bone, a wrist or a knee. Next witness in opposition, please come forward.
Thank you, Madam Chair, members of the committee. Justin Aufferman, representing SSM Health. We'd like to go on record in opposition. Senator, if you go on Google and you type in SSM Health Transparency, you will be brought to our portal that we're very proud of, where you can search any of those charges. You're going to have to specify which hospital you're wanting to go into in one of our 4 states, but it should come up with that information, that charge, and I can walk you through that as well after the hearing, if necessary. Should be able to do it right here while you're sitting here.
Fortunately, once I looked at my phone, I saw 14 text messages and got distracted, but I will check that out later, and I appreciate the effort put in for transparency for your patients. Any questions for this witness? Seeing none, thank you for your testimony.
Madam Chair, members of the committee, briefly, Will Mars on behalf of Mercy, just going on record in opposition. We are obviously very supportive of transparency. We are just concerned about that separate cause of action being part of it.
Okay, so same questions for your client, if you could find out if they're compliant as well and what material compliance would mean to them, and then what the cost of those specific things are. That'd be super helpful.
Perfect. Thanks, Senator.
Thank you. Any other questions for this witness? Seeing none?
Madam Chair, members of the committee, I would like to go on record on behalf of St. Luke's Health System. My name is Kathy Harness, and I'm happy to, I'd like to go on record in opposition to this bill.
I was going to say.
Holy cow. Anyway, for everybody recording this, I am in opposition. I apologize for that. And I'm happy to find those answers out for you on behalf of our health system.
Thank you so much. Any questions for this witness? Seeing none. Any further witnesses in opposition to Senate Bill 1212?
Good morning, Madam Chairwoman, members of the committee. Olivia Wilson, testifying on behalf of University of Missouri Healthcare, opposed to the bill. We are as compliant as we can be. We have several web pages dedicated to our transparency practices. You are able to look up procedures and codes and see how much that would cost, of course, before insurance is factored in. I will get you the information that you're specifically asking for. I'm curious as well. Happy to answer any other questions.
Thank you so much. Any questions for this witness? Seeing none, next witness in opposition. Anyone here for informational purposes only? Seeing none, that will conclude the hearing on Senate Bill 1212 and conclude the hearing for health and welfare for this week.